Hi, dear listeners, and welcome back to Blush and Bloom, the podcast where we talk about women's health, self care, and everything in between. I'm your host, Gigi, founder of Asale, your space for cycle aware and preventive care. I'm really glad you're here with me on this journey to unpack women's health and highlight the incredible things being built in this space. So let's get into today's episode. All right. Hi, Sastya. It's wonderful to have you on the Blush and Bloom podcast. So, for our listeners, can you introduce yourself?
Hi, everyone. So thank you so much for having me here. My name is Sastya Wardani. I'm the co-founder and CEO of Ovy Health. So we are a women health ecosystem based in Singapore and Southeast Asia. And we look to help Southeast Asian women to understand their health better so that they can plan their whole life.
Okay, that's really interesting. And I think we're working in like similar fields. So this is going to be a very fun conversation. And I love that you're doing this in Asia and I'm doing this in Africa. I think we'll see similarities as we go along. So this is going to be fun. Okay.
This is awesome.
Yeah. All right. So you started in finance and you did some work around markets expansion. So before moving into femtech, so was there a moment that sparked the shift? Like you need to build this?
It started as interestingly, it was my finance project. So when I was working in a bank, I was tasked to basically figure out like why Indonesian women are not really, like we call it, like financially literate, right? Why they don't really look into having, for example, like saving accounts, investment accounts, and all that. Then when I did like market research, I talked to like thousands of women, everybody, not only those who's like from the lower income, but also like even those like with a higher income, they always think of their family first. They always think of like how they can help with the family, keep their babies healthy, keep themselves healthy, keep the families healthy. Basically, it's that. But then when we look at like these stages of in like a woman's life, starting from pre-pregnancy to until they're like pregnant, and then even after that through like perimenopause, it's always about the questions like what is actually going on. It's very hard to even look online what is actually happening because it's typically either very much into like medical jargon that normal people wouldn't even know, or it talks about something that more into like whether it's a myth or like a fact. Then I also look into my own experience. I grew up having a lot of issues, just like any probably like teenagers with our hormones and all that. But it kind of grew also into my like early 20s, and it was terrible. That's what I remember. It was just so terrible and it's very unpredictable, and I never knew what actually going on. But luckily, my family are generally in science, especially in biotech and food tech. So we always talk about longevity, how it is for like a woman's health and all of that. Until I realized I'm lucky enough to be able to be in positions where I know better than probably like few of my friends. Whenever I try to talking to them, it's still something that they don't even know. And so for us, the question like, how are we gonna learn about it? Like, where should we go? Where should we find out about all of these issues? It kind of also shown into like the woman in the society as a whole, because then whenever we want to make plans in our life, like the big plan, it always goes back to I'm not gonna do anything because one day I probably just gonna get married and have kids. And, all of this as if our whole life was just meant to be like conceiving, which that's not wrong, but why are we being put in a positions where even for that we have to guess? It is as if it's not in our control. So yeah, like that's kind of like the start of like how I want to do it, because then I want to be able to open this whole access of like knowledge, and if then eventually like what women can do about their health to more people, not only myself.
Okay. That's really incredible. And I can relate. I love that when I speak with Asians from through this podcast, I see a lot of similarities in our experiences, because it's similar case where it's like you go to school, go to uni, and then everybody's like, "Where's your husband?" So,
Yeah.
and then when you get the husband, it's like, Where are the children?" And then it's
Yeah.
like, "What? Like, where are the other children?" And it never ends.
Yeah.
And then it's nice that at least we have this privilege to understand that, like, even though having a family is important, it's not the
Yeah.
only thing that a woman can decide to do with her life. And I guess we're lucky to be from backgrounds that supports that idea, or being able to be in situations that allow us to like explore other things. And then if we decide to go on with that, it's also there. Okay. So, all right, let's talk a bit more about your app itself. As you've already described what it is. So how is it different from all the other wellness and fertility apps that are available?
We do include the component of like a period tracker to try to make it more familiar for like many of other women. But the focus of our app is to make taking actions on the woman's health easier. I think just like what you mentioned before, you're doing it in Africa, we're doing it in Southeast Asia. We understand that culture is very different, right? Like it's impossible to say that you can simply, for example, like bring period tracker to Southeast Asia, for example. So whatever is available out there is not meant for Southeast Asia women, be it in terms of like scientifically or like medically uh like possibilities, but at the same time, it's like the way we approach it to our culture. So within Ovy Health, like the app itself, we start with like what is our goal as a woman that is related to reproductive health. But then every step within the app can give like a proper guideline and step by step on what they can actually do, so that not only that we can tell women like when is the next period, but then at the same time we can also like help them to uh, for example, like assist them in like how it affects their fitness, how it affects their career, how it affects every other part of their life.
It sounds almost like the flip of like yours is for the Asian market, mine is for the African market, because I agree, like these are very important conversations to have, because it's like say things like diets, if you're
Correct.
following diets from say like a cycle perspective, and then if you're only being offered European and American options, it's not going to work when you try to adapt it, or it's going to be very difficult when you try to adapt it for a different market that has, preferences for meals. Like, what do you mean I can't have rice? Like, rice is a very important part of my diet. Okay.
For example, like one of the biggest thing, let's say like in Indonesia specifically, contraceptives is not allowed for unmarried women. It's like legally not allowed.
It's
So
not?
no, yes. So I mean, imagine if like we use apps that like coming out outside of like the region, and then whatever it is, they say take birth control pill. You have this problem, take birth control pill. You have that problem, take birth control pill. That's like almost impossible for us, like Indonesian women. So that put us into a position where then there's no options for us.
I had no idea. Okay, this is interesting. Okay, let's talk a bit more about your app. And I'm still mind blown by this. What do you mean they don't have access to birth control pills? So, okay, so your app blends AI and also includes clinical partnerships. So, how do you balance building a tech product and also balancing the human side of it?
We still believe that this type of care still have to kind of like combine the two. So it cannot be like fully tech. It also cannot be like fully a person for us to accelerate the like providing the access for all of the user. From our app, we try like what we're creating. The whole system is also based on a virtual triage, and then at the end of it, there's always like a person, which could be doctor, nurse, or any other kind of like a real person ready to help the user. The flow would be like this. For example, like you go into our app, you use the app, and then you go through all the whole systems. We have like a very specific algorithm that can help the users to basically to give them a very personalized suggestion. But then at the end of it, the actions that they can take is either something that they do at home or something that they can do with another person. For example, like consultation with a doctor, maybe like an assistant with the nurse, or maybe like a few other things that like someone else available. So that's where we try to combine the two between the tech as well as the human touch point. And we also do that to make sure that everything that we do within the app is accurate, like scientifically and medically are accurate, but then at the same time, it also very personalized and very fast in providing all of this care.
Okay, that's very impressive. So I want to ask you, like, you have working on your PhD at UCL. That's very impressive, and it's in
So,
health. What's DPA?
doctorate in business administration.
That's very fancy. So how does that influence how you're building out your product?
It's I would say it's kind of I think it's I mean in general it's very interesting the way then I realized what I'm missing on in terms of like knowledge while I was like started when I was just started like building this product. But then the whole program itself is actually focusing on being able to provide healthcare to the mass, like the public. So throughout like my studies, then I get to learn more specifically how is it and how it looks like when I combine the two parts, like a business as well as health. Because running a healthcare business or like even the healthcare industry is totally different than every other. I think I would say, let's say when I compare it to like in the finance industry where everything is regulated, I mean it is as well. But then at the same time, it's also an industry where we always have to go through innovations every day. So I think the whole program and the DBA health that I'm doing help us to kind of like understand like how do we kind of like balance between the two innovations, the business part at the same time, making sure that this as a business is sustainable uh, and it's fast enough as well as like regulated just like any normal healthcare industry, I would say.
Okay, that makes sense. And thank you for sharing that. So I wanted to talk about AI because I think
Mhm.
it's very important for this podcast to regularly mention AI and for everybody.
Yeah.
Everybody's talking about how they can use AI in healthcare, which
Yeah.
is impressive and also scary at the same time. So I wanted to
Mm.
get your thoughts on how you use AI for your product and what are your thoughts in general about using AI in women's health.
I think AI is very important in health in general, including like women's health. We use our AI also as a part of like our product. We don't really like to say, or we don't really like to say that we are an AI company, although like we put AI into the soon what we want to see is like AI being something that's like used by everybody because even for us we when we use AI within our product, our aim is to be able to come up with the like the results, the program, like the algorithm and all the suggestions faster than what it was. And that has been the focus on us implementing AI in within like our product and the company itself. So I think what we see in the near future, which I also hope is that a lot more AI are being accepted in healthcare industry, I would say in general, because I do see a potential for it to kind of like make things fast and means like I think time is also money, and so there's gonna be like a lot more people who can
Yeah.
get access just because maybe like in healthcare a lot more people are implementing AI.
Yeah, I think like it's going to be very important, but I
Mhm.
think it's also important to have the guardrails set up because it can
Correct.
get dangerous very fast as well. But I agree,
Mhm.
it's going to make things more. I think your dog wants to be on the podcast.
Mm.
So yeah, I think AI is going to do awesome stuff, especially if, say things
Correct.
like language, being able to have
Yeah.
your app available in multiple languages and stuff. So yeah. Okay. So from your experiences so far or your observations about the industry, what do you think are the biggest gaps in women's health in Southeast Asia when it comes to fertility and hormonal health?
The biggest gap is definitely the awareness
Mm,
that a lot of Southeast Asian women still think fertility as something taboo. And because it's taboo, nobody's are really talking about it. And because nobody's talking about it, even those people who needs don't actually know what they actually need. And just because of that, a lot of people are still missing out on the help that they can get or like the access to care that is possible for them. And I think like including with us and as a company, we have these visions that we can talk about fertility and reproductive a lot more, make it something that is not only trendy but like accepted by a lot of other people, so then at least we can give them options on what they can do with their body and their health.
okay. I agree with you that the awareness is very important, especially like there's this thing I used to tell my brother that like sometimes what you don't know won't kill you, but to make you probably suffer unnecessarily.
Correct. Yeah. Because I mean, let's say if I talk about only like Indonesia, Indonesia is the fourth biggest populations in like the whole world, right?
Okay.
And then if you look at the number of, for example, like IVF cycles done in Indonesia, we're I think only around 2,000 cycles per year, the whole country, 20,000. But if we look at like the third biggest country, the US done around 400,000 IVF cycle per year. If they like, if people say, yeah, but like IVF is relatively expensive in Indonesia, then we look at the country with like the closest GDP to us, India. India has done at least like 200,000 already, still 10,000 like times more than Indonesian women.
Okay.
And just in terms of the number of population itself, it just doesn't make sense. What about everybody else who actually need IVF in Indonesia? Where do they go? Are they not getting at least the access that they need? And so I think it's because maybe the person itself, like the patients, the users, they don't really know like what to do and like how to do it. And that is the kind of gap that I see very, very hard to, not to say very, very hard, but like it's currently exists in Indonesia because of this like awareness and educations about what they actually need. Still,
That makes sense. So speaking of awareness, and we already talked about a bit about like how birth control isn't easily accessible by single women in Indonesia, which is still blowing my mind, even though you said it a few minutes ago. How do you think cultural expectations or taboos shape the challenges that you're working to solve?
we definitely have to go around from our initial plan, honestly. So, for example, we did our initial thoughts that we want to be, the kind of company that says we're doing in reproductive health. And just because of this whole like taboo and everything else, when we talk about reproductive health, then they already think about something else, right? Like maybe STDs that affecting your reproductive health, or maybe like something else. Or sometimes they also think about like, oh, reproductive health, but I'm not even looking to get babies soon, these things. And it was very hard for us then, even like just as a business itself, to really penetrate the market with the like that thought, with like our initial visions and stuff like that. But then we try to understand from like their point of view and look at the where it is easier for them to access, which definitely from like trying to conceive and fertility. And so we change the narrative from like fertility for people who are like trying to conceive. But then we also started like talking to women who still not sure whether they want to have kids now or maybe like later. We also talk to like young women who are like trying to achieve career, but then at the same time, maybe they're looking into this, at least a guarantee for them to have kids later and stuff like that. So I think yeah, it definitely changed, like this whole taboo and all that really makes us change the whole direction that we want to get into without actually losing the vision. It's just the way like we communicate with these people.
Okay, that makes sense. And it's important that you're communicating and getting all this context that you need so you can better frame your product. So that's really cool. Okay. So you've worked across Indonesia and Singapore and Malaysia. Like, what have you learned so far about designing solutions that fit these different cultural contexts?
It's not possible for us to just copy paste.
Yeah.
Even same product. That's what I learned. So
Yeah.
each and every market has different, I would say, affordability, not only in terms of like the price, but also in terms of like their acceptance towards the cost. So even with the same product, we have been marketing it differently in each and every countries. What we do in Indonesia is different than what we do in Singapore. It's also different than what we do in like Malaysia and South Korea and even Thailand. And I think with that, not only that we have to look at the uh like the society, but we also have to look into the whole law and regulation as well, because all of these countries have a very strict, I would say, like family law according to the culture that they believe in. And so it's very, very different, I'll say.
Okay, awesome. It's interesting to like see how it's even for Asian countries, it's not copy and paste, even though it's very different cultures and stuff. So that's really interesting. Okay. So far, while building OV Health, like, has there been anything that has stood out to you that just left a lasting impression on you? Maybe it's from your community or your experience while building out the app that just stuck with you and made you feel like, okay, this is good stuff.
There's been so many, but I think um I would say, like what just came on my mind is like our community that we built and how it is affecting them in a way that beyond our expectation. They kind of really, it's also becoming like an assurance for us to keep doing this or like keep going through it. Because, for example, like a few of them came up to us and say that because of using the app, then they kind of realize things that they are experiencing are actually true. They're able to get diagnosed faster, and so at least that they know what to do with their life, and they know they're not crazy, for like feeling it. Or on another case, like we also experience a person who just felt like all this while throughout their trying to conceive journey feel alone because nobody really understand and nobody really want to listen in that sense, but then nobody also like give assurance instead of just like putting all the blame to her. And now through like what we're offering, she found like another support that she didn't know, like stranger, to the point that it's comfortable for her to share everything, then at the same time familiar in a way that it's not too cold, like the relationship is not cold.
Yeah. Okay. That's really sweet. Okay. So has anything surprised you so far from, say, talking with the women in your community or building out your app or just in general about women's health?
I think what surprised me, although it's expected, it's also still surprising, I think, for me, is that how universal the confusion is. It's like from people who's like educated to maybe like the younger ones, from CEOs to like mothers, it's already mothers, I would say. It's like whenever we started talking about it, people also like these women also say like, I wish I knew earlier, right?
Mhm.
And then it's surprising for me to see how eager women are the moment they're given a chance to like share, like their experience, or even just like look back into like their whole experience, like what they're going through. And I think it's important that we always encourage that because that's exactly what happened.
Okay, that's really exciting to see that women are comfortable to like share their experiences and seeing that I think it's a shared thing that like part of the reason I started the podcast, I think I said this
Mm,
on another episode, was because there's so many things I didn't know. And then as I started building out Atele and having this podcast and talking to women building in other fields, I started to learn a lot of things about general overall well-being, because part of what I'm building is around preventive care. And
mm,
like I said before, sometimes what you don't know, it might not kill you, but it might just make your life harder. So
yeah.
so I think we're headed towards the end of the podcast. So what do you what's your dream ecosystem for women's health? Like, what do you hope happens in the next few years for, say, women's health in Indonesia or maybe in Asia as a whole?
Yeah, I think my dream ecosystem is where access is abundant, like where women can check their fertility and reproductive health as easy and as acceptable as maybe checking their blood pressure. Like it can be done anywhere. And then I when we also, like when we look at the clinic, it's like the clinic should also be integrated with digital support because logistically that's what Indonesia needs. And at the same time, it's also supported by like the financial options. So like for women to actually take the care, the treatment, it's easier for them. It's not exactly as hard to like adding more burden to their life when they decide to do that. And so women can actually feel as a part of a supportive circle, not left alone. Because then when they do need help, on when they decided that they want to take it, it's there, it's available for them.
That would be a dream, I think, even for women outside of Asia as well. So
Yeah.
let's see. Let's see. I think when I look at
Yeah, we're working towards it, right? It will be good in like few years.
it's going to be so exciting to have something like that, especially when you say talk about awareness and accessibility, because sometimes you may have the resources to get something, but you just don't know it exists. And I think it's important,
Yeah.
like the work you're doing to like spread awareness that like if you're able to afford this, you should get it. If you have the resources to be able to pay for healthcare, you should fully utilize that and understand what your options are in terms of fertility options and everything. So it's really awesome work that you're doing. Final two questions, I think. Or three questions.
Yeah.
Maybe four. Okay. So what's exciting for you? Like, is there anything that's happening at Ovy Health right now that you find really exciting that you'd like to share with the audience?
We are in the progress of building our own dream ecosystem that we just mentioned.
Yeah.
We're working towards like a few partnerships that eventually we hope to be able to support or at least become like the foundations of such ecosystem where women can get support in like their access not only from the clinic side but also like from the financial side as well, like a few other things. So that's what exactly we're working on. So hopefully it then can help a lot more women in getting their access, and maybe one day we can finally increase the number of IVF cycle done in Indonesia.
That would be really impressive. Thank you so much for sharing that. So for someone who is listening and they're navigating fertility and hormonal shifts and they feel unseen by the health system, what's something you like to tell them?
I would like to tell them that you are not alone and you're not broken. Your health is not just about reproduction, but it's also about you living fully. And when you realize that, we want to also remind you that there are tools, communities, and people ready to stand by you, just like us here.
Thank you so much. Yeah, I think that's a very wonderful message. Okay, so we have the final two questions. So what would you like to tell 15-year-old Sastya?
Trust yourself. That's what I want to tell myself, like a 15 years old me. Because I think based on my experience, be it in life or even running businesses, the one thing that I felt like was I did wrong and I wish I would change it is to actually trust myself. So, for example, like 15 years old me was struggling so much with a period pain, all of that things, like all the hormonal issue. And I just tell myself, I just have to suck it up. And I keep trying to, gaslight myself that I'm okay, it's just a normal thing. And I should have, like be the advocate of myself more, I think back then, for me to be able to live my 20s better in that way. And I think was also something that I learned early on when I first started like working or like in a business. Like trusting myself was actually really important because that was the reason of, like a few failures that I experienced, which becoming a lesson.
That's very interesting and also very sweet. But then, I mean, you're 15, so
I know.
yourself. But then again, Gen Alpha is going to be a very different breed of. Are they even 15 years old anymore? I don't even understand how they count these generations anymore. Anyway,
Yeah, but I really hope that then becoming better, because then I think the next generation would have us as mothers, and like we hope that everybody like within our generation would understand, like they're out better so that they can become like the advocate for their daughters in the future.
exactly. Yeah, very exciting times.
Yeah.
Crazy things happening in the world, but at least femtech is doing something.
Yes, probably we just focus on the good things, right? Like because there's already so many things going on for like a woman's health, like we can't even think about that anymore. So
Yeah.
yeah,
I
it's
agree.
a nice thing that is happening in the world at least.
Yeah. All right. So I have a final question for you. So for somebody who wants to connect with you and learn more about your platform, how can they connect with you, learn more about Ovy Health, everything else?
Yeah, so if you want to know more about Ovy Health, you can check out our Instagram and TikTok. Our username is ovy.health. We're also available on our website at www.ovyhealth.com, or you can also contact us directly to LinkedIn at Ovy Health.
All right. Awesome. I've not heard somebody say WW as triple W before. This is interesting. This is very interesting for me. Okay. Sorry, I did hope I didn't make it awkward for you.
I didn't realize it. I don't even know like what I was saying.
Maybe this is what I should say, triple W. It's more convenient. Okay. Thank you so much. And I will include it in the show notes and in the description for folks who want to connect with you. So thank you so much. It's been a pleasure speaking with you and learning more about what you're building.
Yes, thank you so much for having me. It's very great what you're doing. I'm looking
you.
forward to your journey as well. Yeah.
Let's see. All right. And this is where I stop the recording. Hi again. Thank you so much for listening to this episode of Blush and Bloom. I'm so glad you joined me for this conversation. If you found it helpful, please share this episode with a friend or someone who might need it. Let's keep talking about women's health and working towards better outcomes for all of us. You can find more episodes and resources at www.asale.tech and check out our app at www.asale.health. And you can follow us for more updates on Instagram at asale.tech. Until next time, I'll see you in the next episode. Take care and bye-bye.